morning, everyone. Today's webinar will begin shortly. Hey, good morning, everyone. Welcome to today's webinar. Before we get started, I'm going to cover just a couple of housekeeping items with you. We'll have all of our participants on mute throughout the presentation, but if you have questions, please feel free to use the Q&A button, or you can also use the chat button. We will be sending out a link to the recording as well as a copy of the PowerPoint presentation that will come to you from an email from IES Zoom user, and that should be arriving in a couple of days, either today or tomorrow. With that, I'm going to turn it over to today's speaker, Holly Singleton. Holly.
Good morning, Susan. Thanks so much. And good morning, everybody. It's great to be with you this morning. I do want to encourage you to use that opportunity to ask questions, either in the chat or the Q&A button should be probably at the bottom of your screen. And I want to really make certain that what we talk about today is meeting your needs. So I have a plan, but if you have questions, we can certainly take a slight detour. Speaking of detours, the title of today's session is At a Crossroads, where workplace safety and mental health intersect. We're going to be talking a lot about kind of workplace safety and how mental health is impacting safety. The goal for today is to make some discoveries. Number one, to have a pretty firm understanding of just who is at risk. When we talk about workers at risk for mental health concerns, who are those workers? And then how does mental health impact safety? Our objectives today are on the screen. We'll be looking at some data and some research just to kind of anchor our understanding. And then we'll be looking at, okay, well, what does this mean with regard to workplace safety? My biggest goal for you today is when we get finished, that you're going to have some awareness of not only mental health, but of resources, because I think really that's the important thing here, is that you aren't left feeling like, well, holy cow, mental health is a concern, but what do I do about it? I want you to leave this morning going, wow, yes, mental health is a concern, but I have some resources and some tools now that are going to help me kind of deal with and address some of the concerns that I might see in my workplace and among the workforce. Now, the last bullet on the screen is really critical, because when we get finished, you're not going to be a mental health professional. What you're going to be is, someone who has some resources and some better understanding. The presentation is designed for safety professionals. So if you're not a safety professional, that's not a big deal at all. But just understand it is designed for folks who are in the role of managing the safety program at a workplace. So the foundation of what we're going to be talking about kind of sits on top of the safety professional's role. Now, to get started, really important is to understand some terminology, because we read and hear and stumble across these phrases, and maybe we're not clear on the differentiation. So I got three key terms on the screen. Mental health. Mental health, it's kind of like belly buttons, eyebrows, and fingerprints. We all have them, but mine is probably different than yours. So everybody has, emotional, psychological, and social well-being. That's just a statement that, yes, we have belly buttons, we have eyebrows, we have fingerprints. Mental illness is when the state of someone's mental health is at a point that it matches or meets the diagnosis of a particular disease or illness. So mental illness is diagnosable. And then that last phrase, a mental health challenge, again, this is something we all face. It's any situation or condition that affects us mentally. And typically, this is a very temporary effect. So whether it's the loss of someone that you care deeply about, or a physical health diagnosis, financial stress, there's all sorts of things, relationship stress, that can present mental health challenges. So these terms, when you hear them, it's just kind of important for you to understand exactly what's being talked about. Now, as we look at mental illness, and we look at, okay, where are we as an American society with regard to mental illness? There's a chart on the screen, excuse me. This comes from SAMHSA, which is the Substance Abuse and Mental Health Services Administration. This is a governmental agency, is a part of the federal government of the United States. They do a lot of research and collection of data. And what you'll see here is kind of how it breaks out. And we're talking about mental illness, and we just saw that definition. So this is a diagnosable condition. These numbers are from the calendar year 2021. And you can see some of the variants here. So among the approximately 60 million people with a diagnosable mental illness, you can see here that females tend to have a little bit higher prevalence than males. I'm going to let you roll that around for a minute, because many people assume that this is because females might be more likely to seek help than males. So this is not necessarily a representation that one sex compared to the other is healthier. It may be a representation that one is more likely to actually go and get a diagnosis. Now, when we look at age groups, young people, so ages 18 to 25, have the highest prevalence. And then you can see, across, ethnicity and race, kind of where things lay here. Now, just for some clarification, we have Hispanic, non-Hispanic, white, Black or African American. This is Native Hawaiian or other Pacific Islander. AIAN is American Indian or Alaskan Native, Asian. And then this bar, actually the highest bar, is when an individual has two or more ethnicities involved in their identity. So give you a little sense of kind of what we're seeing with mental illness. Now this chart, this one comes from the CDC. It's the suicide rate across time. And the reason I wanted to show you this chart is because I think there's been a lot of discussion, a lot of talk, maybe even a lot of headlines in the news suggesting that we are at a very significant level of suicide in our society. We're not where we have been. And I want people to recognize that yes, we do hear a lot about suicide. However, there have been periods in our history where the suicide rate was certainly much higher than it currently is. You can see the peak here. This is during the Great Depression. So we know that that was a very trying time for many people. Now, as it is going up here and we get to 2017, of course, this is pre-COVID. What we do know is if you continued this chart, there actually was a drop. So 2020's rate was lower than 2017. So I just don't want anyone to be left with a wrong impression of where we are with suicide. It's a horrific scenario regardless, but I do feel like it's been a bit misrepresented in the news and some of the headlines. So definitely we need to be dealing with it in a very serious way. Now, number of deaths per year. Now, this is related to deaths among Americans ages 1 to 44. So this is not what we see is we're not seeing people represented on this chart that would be necessarily dealing with, there's long-term health care needs as we age and we become more vulnerable to all sorts of unfortunate healthcare conditions. So this is the younger population of the United States. Now, what you will see here is unintentional injury is the number one. And these four bars, you're going to see 1990 compared to 2000, compared to 2010, and then the red bar is the most recent, the 2020. And when we look at that, our top three causes of death: unintentional injury, suicide, and homicide. Now, what I want to show you next, we're going to talk about how unintentional injury is actually perhaps related to mental illness. So first thing I want to show you, though, is this fantastic chart. It comes from the CDC. I'm going to click on this QR code. You can also grab the QR code if you're interested in looking at this, and I will put the link in chat so that you can grab that in case you don't want to use your phone to look at it. You have it on your computer or other device. What this takes us to is this pretty astounding chart, and it's a active chart. So we're going to watch this chart play out. So if you can see that on my screen, can somebody put in chat, yes, you can see the chart. Make sure you're not still looking at my PowerPoint slide. All right, excellent. Thank you for letting me know that for certain. So this chart represents 1981. I'm going to click the play button up here, and let me put this right now in chat so that y'all can get it on your computers. All right, so a link to this chart is now in the chat session. I'm going to hit play, and you will watch the causes of death change across time. So what you will see right now, you're seeing HIV really jump up there because we're in the early 90s, and that was a huge concern. And then you'll begin to see HIV drop sharply off in terms of death as we discovered ways to treat and help people live full lives with that virus. Now here we're in 2008. Unintentional injury is kind of shifting back and forth a little bit. Suicide just jumped up in 2013. And as we get closer to 2020, you're going to see a significant change. So now we're at 2021, where you can see unintentional injury has skyrocketed, and suicide and homicide have remained pretty significant. COVID joined in there late 2020. What we're going to look at next is what these unintentional injuries actually represent. So if I take all of the unintentional injuries that were represented on that chart, the total being 78,191, and I kind of come down and go, okay, well, what causes those unintentional injuries? And you'll see anything from falls, drowning, motor vehicle crashes, and poisoning. You'll also see I've zeroed in on ages 18 to 45 because this is a real good representation of the workforce, but without it being, totally skewed by those diseases that we might experience as we age. So poisonings is the overwhelming percentage of those unintentional injuries. And as a safety professional, and I'm looking at, the workforce age group, I kind of go, okay, poisonings, that must be, related to exposure to chemicals or nasty stuff. But if we take this 65%, these 50,000 poisonings, and we drill down in the data and ask, okay, well, what are people being poisoned by? This is astounding. 99%, so 46%, 46.3 plus 52.4. That's astounding, because what we learn here is those poisonings are related to substance use. Whether it's, now these are ICD codes, these are medical codes. When someone comes into the healthcare system, they are given an ICD code that verifies here's the cause of what's going on with their condition. Now remember, these are unintentional injuries, so it may be given a code as an unintentional injury because it was an accidental overdose, is why they're in the medical system. But you'll see everything from marijuana and these lovely cousins, and these over here being, a different ICD code, but also related to substances that people abuse. That's astounding, because the next question needs to be, is there a relationship between substance use and mental health? So if we look at that and ask the question, what we discover, and this information comes from the National Institutes of Health. So what we discover is Of the 42 million represented in this graph who have a mental health diagnosis or mental illness, 9.5 million of them also have a comorbidity of substance use. But look at this circle. So this smaller circle represents the fact that we have just shy of 20 million Americans that have substance use disorder, but half of them are also dealing with a mental illness diagnosis. In other words, almost 50% of people who are substance abusers are also suffering from a mental illness. And Brian put in the chat that this is heartbreaking, and it absolutely is. Everything about what's happening with mental illness in America right now is heartbreaking. And these people are in your workforce. And it's important for all of us to recognize that no one is immune. There is not a vaccine. You cannot build immunity. You can help others, help yourself, help each other, learn to recognize and tap into resources that can help. But yeah, I wish I could tell you, yeah, just go to local CVS and get your mental health vaccination and all will be well. Let's look a little bit at in the workplace. So this, to me, I found this data, Brian says heartbreaking. This to me was eye-opening. So let me explain a little bit about the numbers on the screen. What we have is, it's a survey. This was done by the American Psychological Association in 2021. And the questions ask, how often do you experience physical fatigue versus cognitive weariness versus emotional exhaustion? And the respondents were grouped based on kind of their tasks. So the top bar, that gray bar, 38% of administrative, managerial, and professionals who conduct desk work said, yeah, I almost always or always very frequently, I'm feeling physically fatigued. 51% of manual laborers, that makes it right. You would think a greater number of manual laborers are probably going to report that they're physically fatigued. And then work that requires customer interaction. So this would be your restaurant workers, your entertainment workers, service-oriented, the people that are having to deal with people like me as customers. Here's where I think I became totally blown away. When you look at emotional exhaustion, your administrative professionals slid down while our laborers and service providers went up. What we're looking at here is 40% of our frontline workforce is reporting that they are emotionally exhausted. Now, this is taken from the very same study by the American Psychological Association. And what we're seeing here is we just asked the point blank question, do you agree or strongly agree were the answers that mental health and physical problems interfered with your work? Look at this. 42 to 45% of our frontline workers said, yes, my mental health situation is interfering with my work. And down here, my physical problems. Let that sink in for a minute, because I think we have frequently talked about how the physical wear and tear on a worker, particularly let's go with manual laborer, someone who is having to use their physical strength, their physical capabilities to do their job. I would have thought that they would have responded more strongly that their physical condition interfered with their job. But both groups here say that their mental health had a greater impact on their ability to perform their work. Now, drilling into, okay, what are people experiencing? We find that 33% of participants in a mental health study that was done by the Deloitte Mental Health organization, 33% of participants said that they had taken time off from work because of stress or anxiety. Here from the Center of Disease Control, we know, based on what we've captured, listen to that statement real clearly, based on what we have captured, we know that depression has led to more than 200 million lost work days. But how many people are not reporting that that's going on with them? So some of this is extrapolated from data where we aren't relying on people telling us that, yes, I took time off because I was depressed. So some of it is kind of built on models that are estimating. But I'm left after reading some of this research thinking that this number may be low, that there may be more people that are dealing with depression than we're aware of. Now, I put this screen in here. I'm going to take you to this website. If you wanted to capture the QR code, you certainly can. But I'm not going to talk a lot about this. I just want you to know that this tool is there. Whoopsie. I said I was going to take you to that, and it didn't work. All right, hang on. Let me search it for you because I do want you to see what it is. It's the National Safety Council Mental Health Calculator. So National Safety Council Mental Health Calculator. And when we get there, what you're going to find, I'm going to put this in chat. What you're going to find is a tool that you can use, and it gives you a bit of an estimate of the cost. So you're going to key into this, the state that you're located in. I'll just put North Carolina since that's where I am. How many employees you have in your organization? I'm just going to put 250. What my industry is, let's just go, I'll go manufacturing durable. And then I can put my email address if I'd like and get my report. Just a minute. So what this tells me is based on the information that I keyed in, my state, my number of employees, the type of industry, this is an estimate of the cost affiliated with mental health and mental illness. Now, on this website, it has got all the information about how they developed this tool. It's very well done. I was very blown away by the amount of detail that's in that calculator. So just something for you guys to play with if you feel like you'd like to get a little more information about the cost of mental health. Now, mental health challenges. Remember, we did this definition, what a mental health challenge is. It's a temporary situation that does cause us to have a mental health response. So I have a couple of scenarios just represented just to anchor us in terms of what types of things might be going on among my workforce. So here we have a healthcare professional preparing for surgery, but in her head, she says, honestly, I never thought this would be me. I guess I was naive to believe that it would really be until death do us part. How am I going to tell the kids? So relationship difficulties, facing separation and divorce. So here's one related to pressure on the job. What the boss expects is just too much. It's impossible to meet deadlines. I can't find skilled workers to do the job. Mental health concerns within the construction industry in particular have really been problematic. For a variety of reasons. Some of those reasons are unique to the construction industry. However, this one, pressure to get a job done when you don't have the workforce to move that job forward, is not unique to construction. And here's one on isolation. I don't know, I don't really fit in here. Everybody else is older and they've worked here for a while. They laugh at what I bring for lunch and tell me it stinks up the whole break room. I dread coming to work every day. So here we have a worker who maybe doesn't fit culturally into the workforce that he's working with. And you may be on the receiving end of some what we might think is just kidding and picking around, but may land in him a little more personally, a little more hurtful, and begins to feel isolated and not connected to his coworkers. Bottom line, the job impacts our mental health, and our mental health impacts the job. So these things are not separate. You can't kind of divide and go, okay, well, mental health is over here, leave that at home. As much as we might like to say that, yeah, well, you can't bring that to work. Yeah, I know you're dealing with relationship issues. I know that you're having to put your mother in a nursing home or whatever the stressor is. We can't say, leave that at home, don't bring that to work, because those things going on in our personal lives impact us, and we carry it wherever we go. Any questions, comments, thoughts? Please feel free to put in the chat. Anything you want to add, I would love to hear your thoughts. So on the screen, and you will get these slides. Susan will email them to you in the next couple of days. Lots of things going on can impact worker mental health. Some of those factors are taking place outside of work, and we see it coming in to the workplace. Other factors are happening within the workplace. And again, people can't leave everything at home. They're taking the work stressors, everything at work, they're taking those work stressors back home, and it impacts their family. A quote here from Larry Massotti, he's Director of Strategic Relationships on Workplace Safety and Prevention Services, says, "The mind drives the activity of the body, and to work safely, people need to be mindful of what they're doing, and that's part of the safety conversation on mental health." So as a safety professional, it would be easier for me to say, oh, all I deal with is, safety on the job. We just got to make sure they're using PPE, they've got those, machine guards in place. And unfortunately, mental health impacts safety on the job. And as a safety professional, I need to be mindful of that. Doesn't mean I need to be a mental health professional, but I do need to understand that it is part of workplace safety. The kind of old way of thinking through this has been that, oh, well, we just, that's an HR problem. That's not safety, that's HR. The best way to approach this is to recognize that an integrated approach, a partnership, and something where everyone is working together is going to result in the best outcomes. So that comprehensive, coordinated approach is critical. I'm going to talk a little bit about training and how we can use safety training as a tool and a mechanism to make a difference. So again, with the question, why? Why are we going to be doing training? Because the return on investment is huge. Training works when it's done right. So what we have here is, again, from the Deloitte Mental Health Report, and they were posing the question and studying, okay, what's the most effective approach to help people with these mental health challenges and help them to be safe at work? We can refer them to therapy. We can do, an awareness campaign. We'll have posters, and we'll make sure they know the phone number that they can call, or the availability of our employee assistance program. We can provide training, or we can bring in professionals to do screenings for mental health concerns. Now, training falls only behind providing those mental health screenings. So training is a huge opportunity for us to make a difference. The difference between training and awareness, training means that there is a conversation being held, that we are actually talking to people and allowing that exchange, versus awareness training is just putting posters up, or putting a little handout in some envelope that everybody gets. But training means that we are having the conversation and we're allowing people to discuss and talk about the issue. So we're going to rethink some of how we approach mental health as a training topic in our safety program. So safety training, and this is on the screen, this is just kind of our typical approach to safety training. We identify hazards and we train people to identify hazards. We then talk about, okay, if we have these hazards, what controls do we have to control those hazards and reduce the risk? We then provide them with resources and then an opportunity for them to ask questions. So this is a very classic how to do safety training. Let's talk that through with a safety training topic. So on the screen, we've got welding. So if welding was our training topic, we're going to walk through those 4 issues. What are the hazards related to welding? What controls do we have to help prevent exposure or reduce exposure? What resources are available and what are your concerns? Right. Hazards, let's just go with fumes or maybe the intensity of the light. We need to protect our eyes. What controls do we have? Well, we've got shield for our face and our eyes. We've got respiratory protection if fumes are an issue. What resources do we have? Make people know, be aware of where they get that PPE, how to use that PPE, where to go if they have questions or if they feel like the controls are not sufficient, and then what concerns do they have. So we just walk through that very methodically. Now let's apply it to mental health. Are there hazards related to mental health? Are there controls that we can offer? What resources are available and what are their concerns? Right, so the minute we start thinking mental health, many of us pull back and go, oh, that's not my arena. Let's go back here. I've never welded in my entire life, but I don't have hesitancy doing this level of training on hazards because I've learned about welding. I've read about welding. I've looked into, I've observed people welding. I've talked to people who are welders. I've gathered that information and become quite comfortable with going, okay, here are the hazards. Here are the controls. Here are the resources. What's preventing me from doing the same with mental health? Doing a little research, learning about mental health, talking to people who are in the mental health profession, looking into, what are the resources available. We can become comfortable with this as long as part of what we're acknowledging is, I'm not a mental health professional. I'm not a professional welder, but I can give you some information about welding safety. I'm not a mental health professional, but I can provide some information on how to keep yourself safe mentally. So we need to get over that bump that we sometimes get to and go, I don't want to go there. As safety professionals, we need to go there. So let's dig a little deeper. On half of this screen, I've got heat exposure as our training topic. And I want you to look at if you're building content for a safety training, you should start with your objectives. So if I'm building content and I'm going to be teaching and leading a learning session on heat exposure, then my objectives might be, at the conclusion of this session, participants will be able to describe 3 conditions that might lead to overexposure, define 3 ways you could be impacted by working in a hot environment, list 3 ways to take care of yourself in that hot environment, and lastly, describe how to respond if you or a coworker displays symptoms. And look at the other side of that screen. The objectives, when you're talking about mental health, are essentially the same. At the conclusion, you'll be able to describe 3 common mental health challenges that anyone could experience. You'll be able to define 3 ways mental health could impact safety at work. You'll be able to list 3 ways to take care of your own mental health. And lastly, you'll be able to describe how to respond if you or a coworker displays symptoms. It's not that different. And it doesn't need to feel overwhelming. It doesn't need to feel like, oh, this is not what I do. If you do safety, then you need to recognize that a worker's mental health status can impact their safety at work as well as their coworkers' safety. And as safety professionals, it's time for us to embrace this and do our part and not just simply shrug it off and go, that's a human resources issue. Now, I want to talk about how any safety topic. So if you don't want to do a session on mental health safety, you can actually touch mental health issues and strengthen the mental health culture in your organization while you're teaching any safety topic. So on the screen, let's suppose that you are teaching, we'll stick with them, heat exposure. You're teaching a session on heat exposure. It could be anything. It could be hazard communication, chemical safety. It could be, machine guarding. It doesn't matter what the safety topic is. I want you to look at the power of incorporating small group activities, friendly competition, and the opportunity to engage and share with each other provides in any training session. Do you remember when we're looking at the individuals and what might be going on with them? We had the lady working in the OR and she was dealing with relationship concerns. We had the gentleman who was a construction worker dealing with the pressures and stress of getting his job done. And then we had the young guy who felt like he just didn't fit. He wasn't connected with his coworkers. When we create opportunities in a safety training session for people to connect and build relationships with each other, it strengthens the mental health culture within that organization. All right, so here's what I want you to take from this. Providing safety training where you go to a group and you've got maybe a handout or some PowerPoint slides and you say, okay, we're going to take just a few minutes here. We're going to talk a little bit about machine guarding. Y'all need to understand the importance of the guards on these machines and make sure that if you're going to use this equipment, you've got that guard and it's in place. And if that's what your training is, I want to challenge you to hear me say, you're not going to be effective with anything. People do not respond to training when it's simply somebody coming in and just barking the details to them. So all of your safety training, you need to be building in opportunities for people to engage with the content and engage with each other. It strengthens the learning, it strengthens the relationships, and it strengthens the mental health culture of your organization. Again, I invite you comments, opinions. If you have something you want to offer in the chat, please don't hesitate to do that. I want to share now, as we kind of wind this down, I want to share some resources because I'm not going to just dump that on you and go, okay, now it's on you. I do want you to have some resources, and I'm going to put these links in the chat, but also recognize that when Susan sends out the PowerPoint slides, it will have these links on them. She's going to send them out as a PDF, and these links should be active. You should be able to just click Control and click on the link, and it would take you to the page. But I will also, I'll drop in chat while we're talking today. So the first one I want to show you is OSHA's webpage. It's a fantastic resource. They have so much here. Now, it is referred to on their page as workplace stress. Whoopsie, that did not go well. Hang on, I did not grab that whole. So now I have the entire URL. I'm going to post it in chat for you. So, fantastic. This is like one of their best pages on the OSHA website. They have got a lot of information for you, including training resources that you can look. If you've not taken a mental health first aid class, I highly recommend it. I got an incredible amount of information from taking that. This gatekeeper training, also really well done. This is very inexpensive. I think it's about a $30 training here. And then this is just, you download some PowerPoint slides that were put together by the Department of Veteran Affairs. Very good starting point for you if you wanted to do an actual mental health training. It talks a lot about things that are specific to veterans, but it's also got a lot of other really good information. Now, I'm not going to click around on everything. You can kind of see what's here. They're fantastic resources, so enjoy that one. This one comes from the National Institute of Mental Health. Really, really good stuff if you're wanting to put together your own. And let me grab this. Whoops. And use this as a handout. This is a great handout. Drop this one in chat too. Can somebody tell me just by responding in chat, are these links working? Are you able to grab them and use them successfully? This is a great handout. This is something that you could do a very quick little presentation about and then provide this handout. Thank you for letting me know that it's working. Good stuff. And again, this is the National Institute of Mental Health. Here's one from the CDC. And again, good stuff with the CDC. Hang on, let me make sure that's there we go. Grab that URL for you. Boom. They have got this entire article here is available. You can just download it as a PDF if you wanted to actually print it and use it. They've got these infograms that are really helpful. Lots and lots of really good information. And it comes down to this particular page, which all the ones that I've been showing you are very much designed for the workplace. Because sometimes if you just go out and do a Google search, you're going to find lots of information, but it's not specific to what you can do and accomplish within your work setting. So these resources are driven to the workplace. So really good stuff there too. And in closing, the role of the safety professional. So we don't, as safety professionals, diagnose or treat physical health conditions, other than Band-Aids, first aid, and sending people to our occupational health program. But we do talk a lot about physical health. We teach about physical health, and we listen to workers who come and say, hey, I think there's a hazard here that I could get hurt. We need to develop the same level of comfort talking about mental health and being comfortable and inviting workers to come to us when they are feeling like they're dealing with mental health issues. And in the same way that we manage that with physical concerns, we can learn to manage it when people bring to us their mental health concerns. Now, I know that we can't talk face to face, but I intentionally was trying to save a little time to offer you the opportunity to put your questions in either chat or the Q&A. And Susan, I don't know if anything has come through Q&A, but if so, I would be more than happy to address any questions.
I'm not seeing anything so far, but let's give folks some time to type their questions in.
I will share as we wait just a little bit about my background and what has driven me to be pretty passionate about this. Is prior to getting into workplace safety, I worked for just shy of 10 years, right about 9.5 years of my career was spent in substance abuse treatment, where I clearly saw the connection between mental health and drug abuse. So for about 9.5 years, I was in a treatment center and working with folks who were really struggling. Saw firsthand, the impact that mental health has on folks, the impact that substance abuse also has on folks. All right, I'm seeing some chat stuff coming in. So, how to incorporate mental health issues in our programs? Right, someone says it gives them a good starting point. So that's the idea, folks. You're not going to be, you weren't an expert on lockout, tag out when you got started in safety, but you have developed your skills, you developed your understanding and your knowledge of all sorts of safety related issues. I want to challenge you to just wade into the shallow water of mental health such that you can help folks. You can recognize when folks are struggling and offer them next steps. Oh, one thing, some of you may be OSHA authorized outreach trainers. And if so, you know that when you teach the introduction to OSHA as a required element of, when you're teaching an OSHA 10 or OSHA 30-hour class, there's a required module on the intro to OSHA. I just found out about 2 weeks ago that OSHA is going to be adding a mental health handout as a required handout for the intro to OSHA. They're not adding it as a topic that you have to teach, but it will be a required handout that you would provide to folks who are participating in an OSHA 10 or 30-hour class. So that's one of the steps that OSHA is taking. So it's fantastic news. All right, Susan, I'm not seeing questions. I'm seeing lots of folks saying that they feel like they've got some resources they can use, which was really, really fantastic. So anything you need to close up with, Susan?
I just wanted to thank you, Holly, for a wonderful presentation as always. And thanks to everyone who participated today. We will send out the link to the recording and the PDF of the PowerPoint, which will include the resources that Holly talked about. So I wanted to thank everyone, and I hope everyone has a great day and a great rest of the week.
Excellent. Thank you, Susan. Thank you, everybody. It's been a pleasure to spend the morning with you.